Hi, welcome to Endless Nurses World. I hope all are fine. In this video, we'll study about some of the comprehensive questions. So we'll see one by one. The first question is a client who is positive for human immunodeficiency virus delivers a newborn infant. The nurse provides instructions to help the client with care of her infant. Which client statement indicates the need for further instruction? The options are I will be sure to wash my hands before and after bathroom use. The second one is I need to breastfeed especially for the first 6 weeks postpartum. And third one is support groups are available to assist me with understanding my diagnosis of HIV. Fourth one is my newborn infant should be on antiviral medications for the first 6 weeks after delivery. The answer is I need to breastfeed especially for the first 6 weeks of postpartum. Then second question is an adolescent client is diagnosed with conjunctivitis and the nurse provides information to the client about the use of contact lenses. Which client statement indicates the need for further information? The options are I should obtain new contact lenses. Then second one is I should not wear my contact lenses. Third option is my old contact lenses should be discarded. Fourth one is my contact lenses can be worn if they are cleaned and as directed. Answer is my contact lenses can be worn if they are clean as directed. The next question is the nurse teaches a client newly diagnosed with type 1 diabetes about storing humulin and insulin. Which statement indicates to the nurse that the client understood the discharge teaching? The options are I should keep the insulin in the cabinet during the day only. Then second one is I know I have to keep my insulin in the refrigerator at all times. Then third option is I can store the open insulin bottle in the kitchen cabinet for 1 month. Then fourth one is I the best place for my insulin is on the window sill but in the cupboard is just as good. The option is I can store the open insulin bottle in the kitchen cabinet for 1 month. The next question is the nurse is caring for a client scheduled for a transphenidal hypophysectomy. The preoperative teaching instructions should include which statement? The option is your hair will need to be shaved. Second one is you will receive spinal anesthesia. And third one is you will need to ambulate after surgery. Fourth one is brushing your teeth needs to be avoided for at least 2 weeks after surgery. The answer is brushing your teeth needs to be avoided for at least 2 weeks after surgery. The next question is a 6-year-old child has just been diagnosed with localized Hodgkin's disease and chemotherapy is planned to begin immediately. The mother of the child asked the nurse why radiation therapy was not prescribed as a part of the treatment. What is the nurse's best response? The option says it is very costly and chemotherapy works just as well. Second one is I am not sure. I will discuss it with the healthcare provider. Third one is sometimes age has to do with the decision for radiation therapy. Fourth one is the healthcare provider would prefer that you discuss treatment options with the oncologist. The answer is sometimes age has to do with the decision for the radiation therapy. The next question is an infant born with an imperforate anus returns from surgery after requiring a colostomy. The nurse assesses the stoma and notes that it is red and edematous. Based on this finding, which action should the nurse take? The option is elevate the buttocks, document the findings, apply ice immediately, call the healthcare provider. The answer is document the findings. The next question is the nurse is performing an initial assessment on a newborn infant. When assessing the infant's head, the nurse notes that the ears are low set. Which nursing action is most appropriate? The option is document the findings, arrange for hearing testing, notify the healthcare provider, cover the ears with the gauze pads. The answer is notify the healthcare provider. The next question is, the clinic nurse is assessing a jaundice in a child with hepatitis. Which anatomical area would provide the best data regarding the presence of jaundice? The option is the nail buds, the skin and the sacral area, the skin in the abdominal area, the membranes in the ear canal. The answer is the nail buds. Next question is, the nurse is assigned to care for a client in traction. The nurse creates a plan of care for the client and should include which action in the plan? The options are, first one is ensure that the knots are at the pulleys. Then second one is check the weights to ensure that they are off the floor. Third one is ensure that the head of the bed is kept at a 45 to 90 degree angle. Then fourth one is monitor the weights to ensure that they are resting on a firm surface. The answer is check the weights to ensure that they are off the floor. The next question is, the nurse is setting up the physical environment for an interview with the client and plans to obtain subjective data regarding the client's health. Which interventions are appropriate? Select all that apply. The options are, first one is set the room temperature at a comfortable level. Then second one is remove distracting objects from the interviewing area. Third one is place a chair for the client across from the nurse's desk. Fourth one is ensure comfortable seating at eye level for the client and nurse. Then fifth one is provide seating for the client so that the client faces a strong light. Next one is ensure that the distance between the client and nurse is at least 7 feet. The answer is set the room temperature at a comfortable level, remove distracting objects from the interviewing area, ensure comfortable seating at eye level for the client and nurse. The next question is, the nurse is caring for an older adult who has been placed in buccal extension traction after a hip fracture. On assessment of the client, the nurse notes that the client is disoriented. What is the best nursing action based on this information? The option is, first one is apply restraints to the client. Second one is ask the family to stay with the client. Third one is place a clock and calendar in the client's room. Fourth one is ask the laboratory to perform electrolyte studies. The answer is place a clock and calendar in the client's room. The next question is, the nurse is creating a plan of care for a client in skin traction. The nurse should monitor for which priority findings in this client. Option is urinary incontinence, signs of skin breakdown, presence of bowel sounds, signs of infection around the pinch sites. The answer is signs of skin breakdown. Next question is, the home care nurse is visiting a client who is in a body cast. While performing an assessment, the nurse plans to evaluate the psychosocial adjustment of the client to the cast. What is the most appropriate assessment for this client? The option is the need for sensory stimulation, amount of home care support available. Third one is the ability to perform activities of daily living. And fourth one is the type of transportation available for follow-up care. The answer is the need for sensory stimulation. Next question is, what action should the nurse consider when counseling a client of the Amish tradition? Options are speak only to the husband. Second one is use complex medical terminology. Third one is avoid using scientific or medical jargon. Fourth one is stand close to the client and speak loudly. The answer is avoid using scientific or medical jargon. Next question is, a client has refused to eat more than a few spoonfuls of breakfast. The healthcare provider has prescribed that tube feeding be initiated if the client fails to eat at least half of a meal because the client has lost a significant amount of weight during the previous 2 months. The nurse enters the room, looks at the tray and states, if you don't eat any more than that, I am going to have put a tube down your throat and get a feeding in that way. The client begins crying and tries to eat more. Based on the nurse's actions, the nurse may be accused of which violation? The option is assault, battery, slander, invasion of privacy. Answer is assault. The next question is, when creating an assignment for a team consisting of a registered nurse, one licensed practical nurse, and two licensed assistive personnel, which is the best client for the licensed practical nurse? The question options is a client requiring frequent temperature checks. The next one is a client requiring assistance with ambulation every 4 hours. Third one is a client on a mechanical ventilator requiring frequent assessment and suctioning. And fourth one is a client with a spinal cord injury requiring urinary catheterization every 6 hours. The answer is a client with a spinal cord injury requiring urinary catheterization every 6 hours. The next question is, the nurse teaches skincare to a client receiving external radiation therapy. Which client statement indicates the need for further instruction? The option is I will handle the area gently. Then second one is I will wear loose fitting clothing. Third one is I will avoid the use of deodorants. Fourth one is I will limit sun exposure to 1 hour daily. The answer is I will limit sun exposure to 1 hour daily. Next question is, the healthcare provider's prescription reads levothyroxine 150 microgram orally daily. The medication label reads levothyroxine 0.1 milligram per tablet. The nurse should administer how many tablets to the client? Fill in the blanks. The answer is 1.5 tablets. Next question is, metformin is prescribed for a client with type 2 diabetes mellitus. What is the most common side effect that the nurse should include in the client's teaching plan? The option is weight gain. Second one is hypoglycemia. Third one is flushing and palpitations. Fourth one is gastrointestinal disturbances. Answer is gastrointestinal disturbances. The next question is, which nursing actions apply to the care of a child who is having a seizure? Select all that apply. First one is time the seizure, restrain the child, stay with the child, insert an oral airway, loosen clothing around the child's neck, place the child in a lateral side lying position. The answer is time the seizure, stay with the child, loosen clothing around the child's neck, and place the child in a lateral side lying position. Thank you. These are all about some of the comprehensive questions. If you like this channel, can subscribe to me and ring the bell button. You will receive my notifications. Thank you.